Hi, good afternoon, everybody. My name's Kevin Noble. We'll be starting the session in a few moments. Just going to give it some time just for the attendees to join, but we'll be starting the provider pays session shortly. Thank you. Okay, well, it's 12:32, so I think we'll make a start. Good afternoon, everybody. My name is Kevin Noble. I'm the Director of Professional Services at Pinnacle, and we're responsible for the PharmOutcomes platform. I am a pharmacist by background. I still practice in community pharmacy, so I see both ends of this service. I see the service design end and the delivery end at the sharp end, if you like, when I practice in pharmacy on a Saturday. And today's session is about the upcoming switch for the community pharmacy consultation service, which will move from a funded NHS England service to a provider pays model. So we'll be talking about provider pays and what that means for pharmacy contractors. I'll be talking about our solution for provider pays, which is something called PharmOutcomes Direct, which we'll go through and let you know how that will work. And I want to talk to you as well about some of the things we've done and discussions we've been having with large organisations to support pharmacy to make the best use of PharmOutcomes Direct and make it as cost effective as possible, if you like. And that will be via the use of something called Affinity groups, but I'll explain that as we go through today's presentation. So then hopefully we'll have time for some questions and answers. So if you want to put your questions and answers into the chat, we'll go through those at the end of the presentation and try and answer as many as we can. Those that we can't answer, we will come back to you with a full published sheet of answers to all the questions that are put into the chat. Okay, so the community pharmacy consultation service is moving to a provider pays model, and that at the moment is due to happen at the end of September 2021. So if we look at what that means for pharmacy contractors, currently Pinnacle is paid an annual license fee by NHS England, who are the commissioners of this service, and we send NHS England an invoice once a year, and they pay us to manage the service across 6 of the 7 NHS regions in England. From October this year, the new model for the community pharmacy service will be provider pays, and what that means for contractors is the cost of the IT support will move to the provider, i.e. to the community pharmacies. Pharmacies will be able to choose which IT system they use to support the service itself, but they will need to choose a solution that has been accredited and has met the standard to provide you with the functionality to manage each aspect of that service, which we'll touch on in a moment. To my knowledge, there are 4, so information should be published by NHS England in the near future to enable you to choose the IT system that you feel is right for you. We hope it's PharmOutcomes, but the choice is down to the provider. And there is a framework that's being finalised which will give details of the accredited system suppliers for you to look at and make your choice. So that's what it means for pharmacy. So talking about the community pharmacy consultation service and looking at what is needed to support that service, when you make your choice, these are the things that you need to consider. Whichever solution you have needs to have the ability to manage referrals to your pharmacy from NHS 111 call centres via ITK. So ITK stands for the Interoperability Toolkit. That's the message that is sent from NHS 111 pathways into PharmOutcomes. And for those of you that currently use the system, you'll be familiar with the messages that arrive into your services page and present at the top of your screen for you to then record a linked follow-up. So PharmOutcomes will provide you with the same support if you choose to use our solution as you currently enjoy from the system as it is at the moment. There won't be any change to the information flow that the referrals will present in the services page for PharmOutcomes in that web-based environment. You need to ensure assurance around data security. So as an organisation, Pinnacle is ISO 27001 accredited, and we are DSP Toolkit compliant and also Cyber Essentials Plus compliant. So we offer assurance around the security of your data. The system that you use needs to transmit information to the patient's GP via the MESH system. So full of acronyms, the pharmacy world. MESH stands for the Message Exchange for Social Care and Health. And that's a mechanism whereby GP information is passed when you complete the follow-up back to the patient's GP and is presented in the workflow at the GP practice. So currently in the GP practice IT system, so currently there are 2 GP practice IT systems that can accept MESH messages. EMIS Web is one of them and TPP is the other. And PharmOutcomes will send CPCS referrals back to GPs via MESH for urgent supply only at the moment, and we're working with NHS Digital to shortly migrate the minor ailments referrals to send via MESH as well. So we're dependent on a standard being published to do that, and that work is happening at the moment, and that standard is published by NHS Digital, so we can't move to MESH before we receive that standard. We also have a solution which will transfer GP referrals into the pharmacy in the same way as NHS 111 referrals using ITK. So those referrals will also appear in your service screen in your workflow and avoid the need to look in your NHS mail boxes for GPs sending referrals that have adopted that solution. And I want to talk about that a little bit later because it's important that you understand what the model offers you as a solution. The solution you choose needs to validate the patient via the personal demographic service. So again, for those of you who use the platform, you'll be aware that we link to PDS, and once you put in some basic information about the patient, typically their name, their date of birth and their gender, you can ask for a match for the patient's details to be pulled in from the personal demographic service. And that in turn gives you access to our summary care one-click functionality. So SCR one-click is something we introduced a couple of years back, and that requires you to have a smart card in a smart card reader attached to the computer you're working on, but clicking a hang tab that will present in the right-hand side of the CPCS follow-up screen will allow the user access to the patient's summary care record. I often get asked, what role-based access code do I need on my smart card? And the answer to that is B0257. If you've got that code on your smart card, you will be able to use that functionality and go straight to the SCR consent page for the patient that you validated. NHS 111 referrals are securely transferred directly into Pinnacle from the NHS 111 system, which is called Pathways, and that's another consideration. And finally, the last two on here, the bottom two in the right-hand corner of my screen, is we provide you with a template to record any referrals that you may receive via the NHS mail route. As far as with the 111 referrals go, that will only be in the event of ITK failure. We haven't had many ITK failures. One happened once when somebody driving a digger put the digger bucket through a fibre optic cable in the south of England and knocked out quite a lot of infrastructure, but that's the only one I'm aware of. But in the event of that happening, NHS 111 teams fall back to send referrals via email, and we will provide you with a template to record those follow-ups. And finally, and most importantly for providers of the service, we also have a direct integration with the NHS BSA. So we will manage your claims into MYS in the same way as they are managed at this point in time. And that is a good time to start talking about the PharmOutcomes Direct model. So PharmOutcomes Direct is our solution for provider pays. And we sat and scratched our heads long and hard before we came up with a model to offer out to community pharmacy, because this is the first time since Pinnacle has been established as an organisation where pharmacies using the platform will be paying to manage a service themselves. The model up to now has always been the commissioner of the service pays, and this is slightly different. So we're aware that this service you can't advertise because it's driven by referrals into your pharmacy. It's a push service, and you can't do anything until you receive a referral from either NHS 111 or the GP practice. As I say, you can't advertise the service. It's not going to increase your activity on the service if you advertise the service because it's a push service. And we are aware that some pharmacies receive more referrals than others, and this depends on where you are in the country and the levels of engagement within local 111 call centres. So thinking about all of that, it seemed to us that asking for a set fee per month or an annual fee would seem unfair. And certainly in the pharmacy that I work in, we don't get that many referrals, and I would kind of feel I wasn't getting value for money if I was paying a set annual fee. The other consideration is you receive lots of referrals that you can't act upon, and spot the deliberate mistake here. The deliberate mistake was in a fit of madness. I put controlled drugs, but of course you can complete the CPCS follow-up for a controlled drug referral because you would record it as a non-supply and record the appropriate reason. So that was a bad example. But there are patients that get referred to pharmacies that don't attend for a variety of reasons. They may have gone somewhere else. They may have suddenly got better, and they just never show up. So these are all things that we considered when we came up with our model, because of course, when you don't record the follow-up, you will not be paid anything for the service at all. So our model is a pay-as-you-go model. And the PharmOutcomes Direct solution will be a solution that will only raise a charge for the pharmacy when you complete a CPCS follow-up. So when you save your CPCS follow-up, we direct your claim into MYS. You will be paid whatever fee is negotiated, and then we will raise a charge to the pharmacy. So it's a pay-as-you-go model, no annual fee, no setup fee. The service itself will be managed via a new PharmOutcomes Direct portal, which will be accessible from the homepage towards the end of this month, and that will allow you to access information about PharmOutcomes Direct and also to sign up to Pinnacle as your supplier if you choose to do so. And as I say, there's no upfront charges. It's pay as you go. You will only pay for referrals completed at the pharmacy, so we will undertake to ensure all referrals arrive at your pharmacy that are sent via ITK from NHS 111 or from GP practices that are using our integrated solution. And the payments will be collected by direct debit at the end of a month. So the solution we're using is something called Easy Collect. So if you sign up to PharmOutcomes to use our solution to manage CPCS, you'll also be asked to input some information for Easy Collect so that the payments can be collected. We have a group charging model, so the cost of a service can be reduced because we will as far as pharmacy groups are concerned, we'll collect a single payment for the whole group from the group head office or via an affinity group, and I'll talk about affinity groups in a moment, and you'll see how the payment structure works on the next slide. So this last point on this slide is really important because we have a variety of solutions that enable GP practices to send referrals into pharmacies for CPCS follow-ups, and we want those referral solutions to be as robust as possible. The move for this service to provider pays in a way fragments the market. So any solution we put in that allows the GP an efficient, auditable way to send referrals into pharmacy will obviously only work for PharmOutcomes. And we're potentially faced with GP colleagues potentially needing 4 solutions, knowing which pharmacy has signed up to what to send the referral to that site. And we can see there's a lot of complications around that, and it simply won't work. So we've made the decision to cover the cost of GP CPCS referral follow-ups ourselves, and we will continue to deliver those referrals to all pharmacies, irrespective of whether they're signed up to PharmOutcomes for CPCS provider pays, because we've left this out of our model. And that the only reason for that is to maintain that solution as a robust solution that's simple to use and have confidence that the referral sent will arrive at the pharmacy that it's intended for. So the structure of cost is based on a banded charge, and you can imagine that for us, we've moved from having one customer, NHS England, to having potentially thousands of customers that we need to invoice monthly. And the way that we're going to do that is via banded charges. So you benefit from reducing marginal costs as your referral follow-ups increase in number. So let's have a look at what that looks like. And this is where we lead on to a more detailed conversation about affinity groups and how that can help you with making this service as efficient as possible. For the number of follow-ups completed, if you complete between 0 and 10, the cost of that will be levied at 90p per referral follow-up completed. Between 10 and 50 is 85p, between 50 and 250 is 80p, 250 to 2,500 is 75p, 2,500 to 5,000 is 70p, and above 5,000 is 65p. Now, at this point in time, if I was Kevin Noble trading as West White Pharmacy, as I was 10 years ago, as an independent contractor, I'd be saying, well, how on earth am I going to complete 5,000 referrals? I'm not, because I only get 1 or 2 a month. And the answer is you can sign up to an affinity group. So we're having several conversations with different organisations, and we've been having those conversations over the last few months. And we've got several large organisations that are keen to work with us as an affinity group. And what an affinity group is an organisation that can create and manage its own membership to manage CPCS claims for its members. So if you imagine you've signed up to Affinity Group A that has 1,400 members, it's the activity across the whole of that group that your tiered invoice cost is based on. So all of a sudden you've got 1,400 in your group that are completing 5 referral follow-ups a month, and you're already down the bottom end of that cost scale. So the affinity groups that we're working with will publish what their offer is on the PharmOutcomes Direct portal, and you'll be able to look through those pages and join an affinity group. And what will happen is we'll send an invoice to the affinity group, and the affinity group will invoice the pharmacy themselves. So that's how that works. And examples of affinity groups could be, well, the first example is obvious. If you're a large pharmacy multiple, you might make the decision to act on your own. If you have thousands of pharmacies, then obviously the numbers of follow-ups across the whole chain will be significantly higher, and they may make a decision to act on their own as an affinity group using the affinity group model. But we're also talking to membership bodies and wholesalers. So this gives the independent contractor an opportunity to sign up and become part of a larger group of contractors, which in turn means that you'll be able to benefit from the increasing numbers of referral follow-ups being completed across the whole group, which will bring the cost of the service down for you. So a thing worth looking at and something that will reduce your costs. The Affinity group will provide us with a single point of invoicing, and the group activity directs cost, so reduced rates will apply to the whole of that group. So I put this slide in as a new slide following the show and tell event that was organised by NHS England a couple of weeks ago, and some of the feedback we had from that event was, oh no, we're now going to have to sign into something else, PharmOutcomes Direct, to manage CPCS if you use Pinnacle for a solution. And we'll be signing into PharmOutcomes to manage local services. And for those that are vaccinating for COVID, we'll have to sign into Outcomes for Health for COVID. The answer to that is you won't, because PharmOutcomes Direct is the portal that you will use to sign up if you choose to do so. But the referrals will continue to flow into the PharmOutcomes services page. And this screenshot shows how they present in your services page, and there are two there at the top of this page that you can see for NHS 111 minor illness and NHS 111 urgent supply. And clicking on those referrals will open up the details of the referral and allow you to use the structured template to complete the follow-up, and saving the record then will manage the rest of the service requirements for you. So please be aware of that. The service remains as it is at the moment. You'll receive alerts via your management email if you currently use the system. If you're not familiar with the platform, what happens is the minute you get an alert from anybody, if you set a management email address for your pharmacy, you'll get an email to that address to say you've received the referral. Please log into PharmOutcomes to complete the follow-up. And for those of you that have invested in a Pharm alarm, that will start to flash. So that starts to flash for any referral received, not just CPCS. It applies to DMS, it applies to GP referrals, it applies to NRT referrals if you have a locally commissioned service to supply NRT as a result of a referral from somebody. So Pharm alarm will flash for all referrals received, including CPCS. And your service claims will continue to flow to MYS, and the GP alerts will obviously send. So if you choose the solution, it's a business as usual solution, and it will just carry on as far as those current users are concerned with your NHS 111 referrals flowing into the service page, into your workflow. What I've done here is I've given some screenshots of what the portal will look like, just to give you a flavour, and that goes live at the end of the month. I'm talking to the team this morning who are building that, and they're confident that we'll have something up at the end of August. And this shows a user, James Histon. You can see the name in the top right here, James Histon. And he's looking at the choice of affinity group. So this is how the affinity group model will work. These affinity groups are publishing a rate that they can offer you here. I don't know why he's joining this one, because it's not a very good rate, but he's choosing to join the LEBSAC group. I'd certainly be going for this one down here if it was me. And what will happen then is a message will go to the LEBSAC group, and we'll be using something called an API to check that the pharmacy has the credentials to join that group. If an affinity group doesn't have that IT capability, what happens is they'll get a ping, because we'll be setting them up with access to the portal as well. And you can see here that the Histon Pharmacy's application to join the group is there, and then the affinity group manager here, who's Ashley Taylor, can accept that pharmacy into the group or decline it. If this request is sent via an API, it'll all be managed electronically, and the user will get a message back to say reasons why your application has been rejected if they reject you. Provided you're accepted, either manually via the user interface or electronically via an API, you'll get an acknowledgement back to you in your portal, and this has gone back to James Histon, and it's told him that he's now a member of the LEBSAC group, and he will now be invoiced by that group for CPCS. So just moving on from that, and sort of by way of a summary, I guess, the pharmacy claims will be sent to MYS when the follow-up record is saved on the system via the API. The pharmacy will have sight in MYS of the activity that will generate that claim, because you need to go in and say, yep, that's right for me. Please push that claim into the NHS BSA. So you'll be able to reconcile your charges for CPCS against the number of referrals that you've completed and are being forwarded on for payment. Just be aware, and this is the reason why most of our calls arrive to the help desk or emails come in, as we are at the moment. You need to have saved the record before the MYS cutoff. If, for example, you're saving a July claim after the 5th of August, that will go into MYS, but not until the following month. So it'll show there, but it will have missed the claim run. So you need to be aware that the charges will relate to those follow-ups saved in time for the MYS submission, which the cutoff is the 5th of the month. Pharmacies that belong to an affinity group will be charged via that group. So in the case of James Histon, he was joining the LEBSAC group. We would invoice LEBSAC group for all of their members, and the LEBSAC group would invoice James Histon of Histon Pharmacies. For pharmacy organisations that have more than one branch, we have the ability to direct invoices to pharmacy head offices or finance teams for them to manage payments. And for pharmacies that choose to stand alone, and I'm sure there will be some, we will invoice those pharmacies directly. And what will happen is within the portal, you will see an alert that will pop up. And in this example here, I'm logged in again as Histon Pharmacies, and I can see that the June invoice is now available and May is outstanding, and he'll have the ability to click on Pay Now. And clicking on, if I just go back there, you can view the invoice. Clicking on View the Invoice will give you a list of sites and show you the number of transactions that were completed at that site. So you have an invoice that reconciles across to the numbers of transactions that have been completed, i.e. the referral follow-ups that have been completed. So just to close, our aim between now and the time that we change to the provider pays model is to keep you as informed as possible. We'll be using the front page of PharmOutcomes to get information out to pharmacies. We'll also be sending information out using the messaging functionality on the platform. As we get nearer to the go live date for this switch, and information on the provider pays functionality has already started to appear. So invites to join this session, for example, there was a link on the front page of PharmOutcomes for several weeks before today. We'll have a resource centre via the home page shortly, hopefully by the end of August, and that will provide you with information on PharmOutcomes Direct and show you how you can sign up to Pinnacle as your provider. We'll be holding some further webinars. You can tell that this was a presentation deck that I've used before, because I'm saying we're planning one as part of EMIS Live, and here we are, and it's already August the 12th and we're in that session. And a link to the PharmOutcomes Direct portal will be available from the front page of PharmOutcomes by the end of August. So other services that you can sign up for when the portal goes live is you can order things like farm alarms. That's shown in the bottom right hand corner of the screen there. For those of you that aren't familiar with farm alarms, it's a little USB device that you can plug into your computer. It comes with a lead. We've got one in the pharmacy I work in, and we've got it attached to this side of the PMR monitor, so it flashes in your face when we get a referral in for whatever that referral is. But that's what it looks like if you've not seen one, and it flashes in a variety of different colors that you can configure yourself. So that brings me to the end of this presentation, and we can move on to Q&A, and I am looking at a screen here that says there are no questions. If anybody has a question, please feel free to pop it in the Q&A box. Okay, so I've got one here that one of my colleagues has put in. For anyone who already uses a different IT system for CPCS, what will you say are the benefits of moving this over to you? Also, how is this going to fit in with the DMS service with other healthcare settings? So let's just answer, there's loads of questions in here, so let's answer these one at a time. For anyone who already uses a different IT system for CPCS, what will you say are the benefits of moving this over to you? So hopefully I've covered off some of the extensive functionality that we offer to support this service with email alerts on receipt of the referral and the links to various other systems to support ITK referrals into community pharmacy. And the answer, I guess, is you will need to compare cost models and see which one works for you most economically and decide on functionality being offered across the board. How will this fit in with DMS? The DMS is DMS. This is CPCS that we're talking about. So for hospital trusts that use our solution to support the discharge medicine service, they will continue to send discharge medicine services in referrals into the service page of PharmOutcomes. So these are two different services, and DMS is nothing to do with the move to provider pays. So those referrals from sites that use either our integrated solution or the web-based solution will continue to send referrals into the services page of PharmOutcomes. What do you know will be the future when sign up to PharmOutcomes as we move to further integration? Are you in discussions to make this affordable and cost effective with ICSs, etc.? Many questions are there, but all coming to mind. So it's a good question. There are areas of the country that are looking at different ways to fund this service, and we're happy to have those conversations if funding is identified and made available. And we're happy to work with those organisations if they want to have a conversation. So the door is open to have those discussions as and when the need arises. So hopefully that has answered that one. Regarding pay-as-you-go, what does referral completed at the pharmacy mean? So that's simple. NHS 111 sends a referral to the pharmacy. Embedded in the message that is opened, in my slide I showed you how they present in the services page of PharmOutcomes. There are a variety of buttons. You can reject the referral or return it if the patient never attends, or drop it. I think drop is, or close is the term that we use on that button at the moment. Or you can complete it when the patient attends your pharmacy. So only when the patient attends the pharmacy and you actually complete the follow-up, or if you're completing a follow-up over the phone and you're passing medication across to representatives for that patient that attend the pharmacy, and you save the follow-up, that's what I mean by a referral completed at the pharmacy. So the referral is sent by NHS 111 or GP practice, and the referral is completed by completion of the follow-up at the pharmacy. So only when that is saved is a claim sent to MYS. So that's what that is. Does that mean if referred or if the patient could not be contacted, we will not have to pay? Exactly that. If the patient is referred and the patient never attends, you don't have to pay anything at all. It's only for follow-ups that are completed. Linda Ferguson, PCT Healthcare. When joining the Affinity group, will it be possible to join as a group of pharmacies, or shall each pharmacy ODS code need to be added individually? No, you can join as a group, and the Affinity groups will set out their stall on the PharmOutcomes Direct portal, and you'll be able to look up their offering and decide which one suits you, but you'll certainly be able to sign up a whole group. So that's not a problem. Hi, so is Pinnacle an IT provider? Thanks, Fatima. Yeah, we are. We're approved for supporting CPCS. We are a web-based service management solution. We currently support other services such as, we've already mentioned the discharge medicine service. We're currently supporting the COVID vaccination service, and we'll shortly be supporting the seasonal influenza vaccination service. So yes, we are an IT provider. One here from Anonymous, flu vaccinations continue as normal. Yes, they do, unless you've signed up to be a phase 3 COVID site. If you're a phase 3 COVID site, we have developed a template that will allow you to record both COVID and flu in one template. For pharmacies, if this question is from a pharmacy who are Planning to offer the advanced service seasonal influenza vaccination. There will be a flu template made available as soon as we get the PGD, which is yet to be published. It's the template is built, is ready to go, but we're waiting for the PGD to finalise that template. But yes, that will be business as usual. Next one is from Anonymous. GP CPCS referral to a pharmacy and post-event message back is totally free, just to confirm. So it's processing the payment for it, and CPCS that costs. Yep, it's everything else that goes with it. So it's all of the assurance that we have to go through to prove that we're secure, a secure solution, that we have to integrate with every single call center in the country and manage those connections via ITK. We have to manage the links to MYS, to send claim information electronically into MYS for the pharmacy. We have to alert sites of their referrals. So yeah, there are certain things that are free, but a lot of this is a very, very complex service to manage, and there are lots and lots of moving parts. So it's all the rest of it where there is support costs. Can provider companies operate as an affinity group? Yes, you can. If you want to have a conversation about becoming an affinity group or explore if that solution can work for you, drop me a line. My email is kevin.noble@emishealth.com, and we can set up a call and chat through how that might work for you. You've mentioned wholesalers for affinity groups. Will this apply to buying groups also? This may be a better for independents, especially. It does. You're absolutely right, and we are in conversations with some of those groups. So there are several large organisations that we're currently talking to, who we're very close to reaching agreement with. Some are membership bodies, some are, as this person has asked, they are buying groups, and others are wholesalers. So. And some of those are both, but we are certainly in discussions with those. But as per my answer to the previous company, if you manage a group of pharmacies at all and you want to have a conversation about being an affinity group, let me know and we can have a conversation. I think that's all of the published questions that I've answered. Okay, well, we'll be completing a formal reply to all of these and publishing that and making that available for people that have attended today. I believe a recording of today's session will be made available for those that couldn't manage to make the meeting. But all that remains for me to do is thank you very much for attending the session and wish you all the best with your decisions around provider pays and the very best of luck with managing that service moving forward. As I say, we hope you choose Pinnacle as a supplier. But irrespective of that, thank you again and have a very good rest of the day. Thank you.